Good morning and happy Friday. Welcome to Fridays on the Porch, an unscripted, unedited, uncut podcast, or porchcast, if you will, where we talk about all things holistic health and healing and how we can help our bodies get in alignment and stay in alignment. I'm your host, Dr. Drkatieoshea, learning my last name today. And today I am joined by one of my colleagues here at the center, Rebecca Fanali. Hello, cheers, welcome. Friday on the Porch.
Friday on the Porch.
Rebecca is an acupuncturist here at the Center Life and Balance, so we thought it'd be a great opportunity. I have gone to her, love what you do, just to give some more exposure to the world of acupuncture, how it supports health, and thank you for being here.
I'm so happy to be here.
So tell our viewers, how did you get into acupuncture? How'd you find yourself in this space?
I received acupuncture the first time when I was 13.
Okay.
I was visiting my aunt in California, and it was very well known there at the time. I had really bad anxiety, and she's like, I'm just going to take you to my acupuncturist. And I remember walking out of the session being like, this is what I want to do.
Wow, at 13.
Yes.
Okay. What did you feel in that session that you just knew at such a young age?
I remember she had a little buzzer, and she was like, you can press it and I'll come in the room if you need me. And after she put the needles in, I wasn't sobbing, but tears were just rolling off my face. And at that time, both of my parents, they struggled with addiction, and they had just been sentenced a pretty long sentence in court.
Oh, wow.
So I didn't know where I was going to live, if I would go back. I was living in Texas at the time.
Okay.
And I was kind of shaking a little bit, and I was like, is this normal? And she was like, it's all the stress just leaving your body.
Wow.
Like, just let it happen. It's a release. That's what acupuncture does. It helps move chi and all that stuff that we hold inside. And I was like, this is incredible.
That's so, wow. I did not know that story about you. And wow, that's amazing. And then to know at such an early age, like, this is what I want to do.
Oh, yeah.
Okay. So did you keep having acupuncture done through your adolescence?
Mm-hmm.
Okay.
So I ended up going back to Texas, and I would actually have phone consultations with her. I kept in touch with her. She would send me herbs. And then whenever I got licensed, I reached out to her, and I was like, this is because of you. So thank you.
Wow.
Very sweet.
Oh, what a great, and just to have that appreciation and tie back and gratitude, right? Like, that's really what it's all about at the end of the day, helping the next person move forward. So what is acupuncture for people who don't know?
So I always like to start with saying that, yes, it is needles. No, it doesn't hurt. Because
it doesn't hurt. I can agree to that. Yeah.
And a lot of people are like, how do you relax if you have needles in you? And I promise, they're the width of like 2 pieces of human hair. They're very, very tiny, and they're almost like little electric conductors. So acupuncture itself is the treatment of the chi in our body. So we have chi, which is our life force energy. And it runs throughout the meridians, which are the channels that the acupuncture points are on. So what I loved about acupuncture, the 2 main causes of disease are diet and emotion. And that's not really looked at whenever you go to a Western physician. And I appreciate Western medicine, but I just loved how it really looked at the patient mind, body, and spirit.
Okay.
Versus just treating symptoms. So it helps move the chi, because whenever we have, we internalize emotions, what's happening in our life.
So much so.
Trauma, like a physical accident, if we're eating poorly, our chi gets stuck, and then other stuff can manifest. So it just helps move that so it free flows, and it really works with the nervous system, because our body has the ability to heal itself. So it elicits the body's own intelligence, basically, to like snap it back into what it needs to do.
Kind of takes the brain and says, you've worked hard enough, away you go for a little bit.
Yes.
Let the body just do its thing. I think that's a beautiful thing. So do you find needles keep people away, or what?
It's hard, because I know immediately whenever I say I'm an acupuncturist, they're like, oh no, I don't like needles. I'm like, I totally get that.
Yeah, totally.
I did a couple career days at middle schools.
Oh, how cool.
And I would needle myself. I'm like, I don't even flinch. I don't feel it. Like, it's not meant to be painful.
Yeah.
It shouldn't be. There are some styles of acupuncture that, have deeper needling. I don't practice that way.
Okay.
Because I don't like deep needling, so I'm not going to do it to my patients. But definitely the fear of needles is one, and just the not really knowing what it's for.
Okay.
Or what it can do.
Gotcha. Do you think, and I will say, I mean, I've had acupuncture, like I said, with you a couple times, and I fell asleep, right? And I'm an ICD-10 anxiety girl, right? So for my brain to be able to stop and take a break is huge. And you really don't feel them.
No.
It was wild.
I try to tell patients, just by inserting the needle, right? We're breaking the skin barrier. So it's considered a micro trauma. I don't like the name because it sounds really painful.
Sounds like I need some counseling for that, or okay.
But because we are breaking the skin barrier, you are sending a signal to the brain. And so they have done studies where it shows the areas of the brain that are like light up whenever you get acupuncture.
Okay.
And it not forces your body, but it puts you into the parasympathetic nervous system. So it puts you in that rest and digest. And a lot of people just live in fight or flight.
Constant.
So it kind of like breaks that cycle, and then people fall asleep. Okay. And it's amazing because then I'm like, yes, like your nervous system, it was able to rest.
This is what we need.
Yes.
Get the cortisol down and out and all those things. What are the benefits, like short-term duration when you have an acupuncture session, and then long-term?
So it's so individualized to the patient, so it does differ. But what I love about it is it can literally treat anything. So obviously we're not curing anything with it,
right?
But it can be used for preventative measures. It can help manage symptoms of medications and even like physical injuries. If those are the ones that you'll see more of a relief pretty quickly, because we are actually needling the muscle and saying you need to relax.
Right.
So you'll feel that relief when you get up off the table. But for something more chronic, it's going to take a couple more sessions.
Gotcha. That makes a lot of sense. As a PT, I think about patients with muscle injury, right? Outside of the emotional trauma and those things, but just your chronic tendinosis that's turned into the tendinopathy. And we know the muscle fibers change, right? And there are medical procedures that go in and are very painful to strip that muscle down, right? But yet acupuncture is such a great alternative to kind of force the same healing cascade that happens with a little more ease and comfort, to the patient, right?
So I have a lot of patients who are trying to prolong the inevitable of a knee replacement or a hip replacement. Sometimes that's
right. Sometimes it happens,
but they'll come to me and we can at least prolong that until it's absolutely necessary.
Okay.
And then whenever they do get it, it helps with the recovery process as well.
That's exactly where my mind was going on a question, because while here in this space, I practice as a Reiki practitioner, but as a PT in 18 years, I can't tell you how many pre-op patients we see for knees or hips. And they come in and they're arthritic and in pain and they don't want to be there. And they're like, this is a bunch of, I don't know if we can curse on this, probably not, so we won't. Right? But yes, it's that thing. But we're not fixing that knee that needs the operation. We're strengthening the whole body to help that outcome of that surgery. Right. So similar with acupuncture too, getting more alignment. Yes. Because we know if you go into a surgery with better anxiety, emotions management, you're probably going to need less anesthesia, your recovery time, lower risk of AFib, all those things that really can hurt the body.
Yes.
Okay, very cool. Now, acupuncture is covered some insurances.
Yes.
Not covered others.
Yes.
Demyth this for us.
The insurance world is a little strenuous. So I personally don't accept insurance because it's there's so many different plans, and they'll say that they will cover it and then they decide they're not going to cover it, or they're only going to cover a percentage of it. So the reimbursement is very inconsistent. What I do for my patients, if they have insurance, I tell them contact whoever you have, ask what your acupuncture benefits are. Some they will only cover for specific diagnosis codes.
Okay.
So that's important too, because if you're not coming in for one of those codes, then they're not going to cover it. So I'll write super bills so they can submit it and see if they get reimbursement. But I tell them up front, you pay me, I don't get paid by insurance. So it's kind of you don't know if you're going to get reimbursed.
You don't know. But I think there's so much that we do preventative in life, right? And then some are good habits, acupuncture, gym, massage, Reiki, things of that nature. Some are bad habits, right? Like, we'll leave those habits off the air, right? But people are willing to invest in themselves when they see the benefits.
Yes.
Do you think, do you think though, because there's research that supports benefits of acupuncture, long-term studies, not just quick little studies, right? Do you think insurance will ever move into a space of globally recognizing and reimbursing acupuncture for what it's worth?
As of right now, it's hard for me to say yes.
Yeah.
We do have, I will say, I'm part of a couple of acupuncture groups because I'm licensed in Jersey and PA.
Okay.
So I'm in those groups, and I will say the New Jersey group, they are in the PA too. They're very active in like lobbying for our scope of practice and what we can do. But unfortunately, we have such a small number compared to like MDs, even PTs. Like there's not a lot of us. So it's hard for, I think, our voice to be heard.
Okay.
I wish they would see it more as beneficial because there are so many studies about it, but I don't know if we'll get there.
Yeah. I sometimes wonder about that, a lot of healthcare, and we have such a reactive approach to healthcare and healing, and it'd really be nice to see the world get into a proactive piece where an hour of time spent with someone whose intention is for your highest good, what that outcome has on someone's life and effects and all those things.
And I did a study abroad in South Korea.
Oh, cool.
And just being there and their way of treating, your initial treatment is acupuncture and herbs. And then they'll do other medical interventions if needed. So I just wish that we had that approach here.
Wow, okay.
Because it's preventative for a lot of things.
Yeah.
And you also, like, longevity wise, like they do so many studies on acupuncture. And I mean, look at the masters of acupuncture. They were in their hundreds.
Yeah, I was going to say,
I'm living a very long time.
Yeah. Okay. So give us a little acupuncture history, because
it's so. I think it's about 3,000 years old. Sometimes, like the classic text would say 3,000 or 5,000. I think it was about 3,000. It's hard to really say,
right?
And I don't want to say anything incorrect. But the way that they were using acupuncture and finding these acupuncture points that correspond to organs without having x-rays or like any way to see internally.
This is a really good point, right?
Incredible.
We didn't have those.
Brilliant. And I had a course in my schooling where it was comparing East and West, because we also have to learn Western diagnosis and know red flags and like when it's not in our scope and when we need to refer out. But we learned the physiology from a Western perspective and then how it correlated with the Eastern, and it's so very similar. Yeah. And I was just fascinated by that. Like they knew so much with none of the medical advancements that we have now.
Right. It makes you just realize, I think, the intuitive piece of it. And like you said earlier, we have the capacity and ability to heal ourselves. And people have been doing this long before you and I have walked this earth, right? Which is really cool. Yeah. So now we're going down like the nerd path, because now I'm really excited. All right. So chakras, meridians. Tell me the difference between the two, because I work in the chakra world and the organ world of the Western health, but what's the difference?
So with acupuncture meridians, there are so many. So you have like your 12 primary channels, which correspond to 10 major organs in the body. Okay. And then you also have other meridians like that are very deep. Okay. And they're called like extraordinary vessels. Okay. So there's a number of channels. With the chakra system, you have the 7, right? I can't even remember how many channels we have.
Okay.
But like the chakras, like it's what I love, because I'm Reiki too.
Okay.
And whenever I do have patients who will get Reiki add-ons to their acupuncture treatments,
Okay.
which I love doing that, because if you look at the chakras,
Mm-hmm.
there are acupuncture points that correspond to those.
Okay.
Yes.
And now are those acupuncture points on the chakras the same as the organ points that connect to the chakras?
That I don't know, but so, like example, the solar plexus.
Okay.
Right.
So right above our belly button. Okay.
That is a point for the stomach.
Okay.
And that's, location wise, it's where our stomach is.
Sure is right there.
So, and I love, like, when I do the Reiki, I'll see, which ones were a little blocked or we needed a little extra love on those. And then
Okay.
I will do the acupuncture point for that chakra, basically.
Okay. So is that more like the spinal wave we hear about? Or is that more, have you heard about this?
No.
All right, so I'm going down like a TikTok rabbit hole right now. So forgive me if there's some facts that are a little bit wrong. But there is I think she's a chiropractor and she's on Instagram. She's based out of Australia, I think. And she does a lot of spinal energetics and talking about spinal flow. And that's really the tip of the iceberg that I know. But she talks about spinal flow and looking at really like the stuck points in the body. So
we have a meridian. It's called the dew channel.
Okay.
Or the governing vessel. And it runs from, it's basically your whole spine.
Okay.
So there are two. There's the governing vessel, and then which is dew, and then the Ren channel, which is a conception vessel, and they run in a loop.
Okay.
Like from
top to bottom.
Yes. Nothing on the legs, but
Okay.
your complete torso. So anytime someone has any sort of back pain, I open up the dew channel.
Okay.
Because it basically just unclogs the entire spine.
That makes sense. And then we think about Western world, cerebral spinal fluid, inflammation, all the things that settle in.
Yes.
That makes a ton of sense. Wow. So you do that.
I do.
Sorry.
Sorry. Thank you. Yeah, it's pretty interesting. And
that's
the
neat.
very top point, it's our most, we call yang point, is dew 20. And that is also like the crown chakra.
Right, that's our crown chakra. So our enlightenment, sort of connection with source, whatever that might be. Okay.
And I think the translation of it is point of 1,000 lights. I should know that. But which I thought was really cool, because if you think of the crown chakra and like just the opening, and then the translation of the Chinese acupuncture, like they really do relate.
So it's very complementary. I know we went down a sidebar of the dew and the other channels, but when you're talking about the solar plexus and the stomach, that I can't help but think that's where we keep a lot of our cortisol, right? And that brain gut connection, which we know is so inflammatory, and where a lot of us have our emotional issues with self-esteem and self-regulation that we know through the Reiki system, that it makes so much sense how correlated that is.
Yes.
That to me is fascinating. And it's fascinating that we don't talk about these things in our Western healthcare world, which I love and I still work in and will continue to.
Yeah.
But it really is interesting to see the connection between those.
Yes.
Wow. So have you heard of functional neurologic disorders? They used to be called conversion disorders.
Oh, yes.
And so there's now new terminology. It's functional movement disorders is what they're called now, FMDs. And the idea was to get away from conversion, because conversion kind of has this negative connotation that like you're doing this to yourself, versus the fact that this is a true underlying mental condition that you have experienced. This is your trauma response, protective. This is a fascinating diagnosis to me. And I bring it up because I had a patient yesterday and went from needing two people to totally walk, probably from here to where our door is, right behind us, right before the hay bale. And for the first 4 or 5 steps, totally dependent, like being lifted by myself and another therapist. And then with just cueing and kind of the right verbal strategies and coaching strategies, this person then went to walking independently. Wow. I'm a decent PT. They're far better than me. but none of us are that good, right?
That's amazing.
And that to me just says, wow, there really is this connection. But our healthcare system treats this person like a chronic admission, not getting better. There's still a negative, even though we've changed the ICD-10 code of everything.
Yes.
What kind of space do you think there is to bring the Eastern world into that system, and how do you think it helps? Like, how could it help?
Because of the profound effects that acupuncture has on the nervous system, I think it would be very beneficial, because it's with something like that, we always talk about when we're treating, our intent is so powerful.
Right.
Right. And so your mind plays a huge part in your healing. So by changing from conversion to, just that helps, right?
Yeah.
And then learning how to speak to that patient, and you're basically just creating more neural pathways, basically.
Okay.
And what I've learned in my school, we have another type of acupuncture, another style. It's called 5-element, and we have all 5 elements within us, but we operate mostly out of one. And what I learned with that schooling is how to validate my patient by speaking through their element, basically.
Okay.
So I think that's kind of the same thing, where with this, you're, saying things to this patient to help them kind of get through those mental barriers so that they can walk independently
And then get back to themselves. That makes a lot of sense. Do you think you'll ever see acupuncture in a hospital?
Yes, so there is.
Okay.
There are now.
But tell me more.
Yes.
Okay.
So when I was in the herbal program, there was a woman doing it as well, and she worked in hospitals with stroke patients.
How cool.
There has been so many studies showing the efficiency of acupuncture immediately following a stroke. So the recovery is incredible. And when you have a stroke, if it's in one side of your brain, it's the other side that's physically impaired.
Right.
So you do scalp acupuncture along that motor line and the sensory line. And if you do it very close to post-stroke, it's so beneficial. But there are only some hospitals that allow that.
Okay.
It's not as common.
It's not as common. Okay.
There's also, so I love fertility and women's health. That is my passion.
Okay.
I treat everything.
Yeah.
But that just makes me so excited, because I'm also a birth doula, so I can treat them.
Didn't know this about you.
I can help them get pregnant. I can treat them through their pregnancy, and then I can be there for delivery.
Okay.
Which is just so rewarding.
We're going to talk more about this. Okay.
But oh, I know, I got so excited. Now I
know
what I was going to say.
About hospitals.
Oh, yes. Okay. So recently with, there's more infertility issues.
Yeah.
They are having acupuncture in hospitals for that as well. So they do laser acupuncture, which is no needles. It's just a laser. And I haven't looked into that. I don't really know how effective that is.
Okay.
But I did work for someone who, he's very well known for his fertility clinics, acupuncture-wise, and he will go into hospitals and he'll do acupuncture before the embryo transfer and after.
Oh, how cool is that? Wow. Mm-hmm. Oh my gosh. My little nerd brain's like, oh my gosh, all the studies you could do on that?
Oh, there's so many. It's so fascinating.
And the outcomes of those children. I would think, I know the mics don't pick up on the trucks, but I really feel like they do. So forgive the pause. But I'd have to think, as someone who's gone through, trauma recovery and all those things, to think about being born in a place that you're conceived in a true balance. Like, what kind of superhuman are we creating?
It's
so cool. Wow. That is really neat. So you're right. I mean, the fertility struggles, I have a lot of friends that have experienced this, a lot of losses. Yeah. I mean, what are your thoughts?
It's, so whether they're trying to conceive naturally or they're doing IUI or IVF, it's very emotionally charged.
Yeah.
And unfortunately, when you get to 35, you're deemed geriatric pregnancy. So that alone, just that word, you
So
already
offensive.
have a negative connotation. And I'm like,
Right?
we need this to be positive. You need your cortisol levels down. Like,
Yeah.
you want to be hopeful, but then you're so scared because of losses. So it's just, there's so much emotion. And especially if you're doing like IVF, you're on all of these hormones, which just amplify all of your emotions, and you get side effects from those. So with what I've seen with the acupuncture, it allows a safe space
Okay.
to come in, relax, like leave everything. It's mostly the expectations of the patient, because they internally think that there's something wrong with them. So now they're having to outsource,
Okay.
and it's so much pressure.
Oh,
And you're trying to grow a human. So I'm like, let's
it's a lot of work.
leave that at the door.
Yeah.
Let's have you relax your body. I really encourage body positivity, and I always say, like, you're magic, this, and also helping manage the symptoms from the hormones as well. Acupuncture is great for.
Okay.
So it makes that process a little easier as well.
Okay.
And then when it comes to, if they're doing IVF, the transfer, I have them come the day before, like within 24 hours of the transfer.
Okay.
Then they'll get the transfer, and I tell them to come here immediately
Okay.
after the appointment, and then I do acupuncture as well.
Wow.
So that way, your body is it's as calm as it can be.
Mm-hmm. And in a state to receive and to grow.
Yes.
Right? Wow. That's beautiful.
And then if there is, like history of miscarriages or stuff like that, we do acupuncture points all in the top of the head to help raise their chi. So it helps with implantation and holding the pregnancy.
Okay. Wow. That's, just a fascinating world that so much is needed, and so much resources and guidance, and people who genuinely care and want to help. It's really cool.
Yeah.
Wow. What about the gals going through the menopausal changes?
Oh, yes.
Is that something that you get involved in as well?
Yes.
Okay.
So that's why I say, like, I love fertility, but also women's health. Because unfortunately, there's not a lot out there.
No.
I mean, there's hormone replacement therapy, but there's also a risk of cancers with that. So
you might not sweat, but you might be chemo.
Right.
And then you'll sweat.
So I love, like, I've had a lot of perimenopausal, menopausal, and postmenopausal patients.
Okay.
And acupuncture can really help with that, but that's where I truly lean on the Chinese herbal medicine as well.
Okay.
So that's a separate degree in Jersey and Pennsylvania. I think there's only a few states that require you to have herbs before you can practice. Here it was separate, and I knew I wanted to do the herbs because I was making potions at 4 years old with like twigs, and I was like, I want to make potions for people.
You knew.
Yeah. And the formulas that we have, what I love is, like, you have classic formulas, but then based off of a patient's tongue and their pulse and their symptoms, like, you take in what they're telling you, you can create an herbal formula that is specific to their diagnosis and what they're going through.
Okay.
It's just amazing because think of, like, the hot flashes, the insomnia is a big one. Sometimes even restless leg.
Okay.
And it helps just kind of quell everything.
That's it. People are just looking for relief at that point, right? Think of just the bad night's sleep in general, let alone if it's ongoing. Sounds maddening.
Yeah, I take insomnia very seriously because I'm like, that's when we recover. You have to sleep.
You need to sleep. Yeah.
If they're coming in with a lot of stuff, I'm like, let's get you to sleep.
Okay. So what would the herbal medicine piece look like for your clients?
So if they're interested, we schedule like an herbal consult because it's even more in depth than your acupuncture intake. So we really look at the tongue, which is a mirror of what's going on inside the body.
Wild.
It's so cool.
Trying to keep my tongue my mouth closed now, like she's gonna look.
So there are different areas of the tongue that correspond to organs in the body. We're looking at the color, the shape of the tongue, if there's any, geographical markings, if there's a coat. It's so in depth and so cool.
It's so cool.
And we also have to go over like allergies. There's different forms of herbs, so you can get raw herbs and cook them and make a tea out of them. That's the traditional way.
Literal.
It's amazing.
Okay.
Or you can get a powder form that you just put in warm water, much more convenient, also very effective. Or there's actual pills.
Okay.
So the powder's in a capsule, and that, so I always like to ask, would you actually cook the herbs? It's okay if we want to do it more convenient, as long as you take them.
Mm-hmm.
And then we take into consideration budget as well. So I'll try and really make it where it's doable for the patient.
Which makes a lot of sense, right? Because how often does price keep people away from all types of medicine, Western and Eastern? That's really actually very, I think, good to know for viewers that it is.
Yeah, we can always switch herbs that are just as good and beneficial for the formula and just not as expensive.
Okay.
So it's more attainable.
And that makes sense, like our generic and our name brand in the Western world of medicine. Okay. So are there any people that you mentioned earlier contraindications, things of that nature? Are there any people that just acupuncture isn't a right now or a never?
It's honestly no. I mean, there are like certain points that are contraindicated for certain conditions, also with herbs. And that's why the herbs is so in depth too, because we had a pharmacology part of the herbal program as well, because we had to learn how certain herbs can maybe negate Western medications or increase the effect of them.
Mm-hmm.
So that's why it's also
very important.
But it's so gentle. It's not invasive. I truly think everyone should get it, but there's not one thing. The only thing that I take very cautious with is post-surgery.
Okay.
So that I'll say, I know I'm not going to do anything that's going to harm, but maybe let's just get that, approved by your physician and see when you can be cleared to come back.
That makes sense. Okay. And then, so tell us a little bit about like the educational background and journey, because you've mentioned a lot of, I think, really interesting pieces of the correlation between the Western and Eastern. So for folks that are maybe more Western based and expect that, MD designation, you do have a doctorate, correct?
So
yeah,
I don't.
Oh, okay.
It's a master's.
It's a master's, okay.
But our master's program is 3 years long.
Okay.
So the amount of hours that we had is equivalent to what a doctorate would be. It's just not recognized as that.
Okay.
I started my schooling in Florida. If I would have stayed there, I would have graduated with a doctorate. It was recognized in Florida. It's not here.
So it's state specific.
It is. Like, we have a national licensing board.
Okay.
That we have to, there's 4 different boards that you can take. You have to have 2 specific in every state to be an acupuncturist. Some require extra, like Jersey. I had to take the biomedicine board to be a practitioner here. In Pennsylvania, they don't require that. So it's very state specific.
Okay.
And in Florida, you only needed an associate's degree to start the program. Here, you needed a bachelor's.
Interesting. Okay.
Yeah.
So it's a lot of schooling.
It is so much schooling.
Oh my gosh.
So I got my bachelor's in behavioral neuroscience. I really wanted to be a neurologist.
Okay.
So I thought, okay, at the time, I'll get my MD and then I'll get my acupuncture degree.
Okay.
So maybe I'll be taken a little more seriously if I have like MD. But then I was studying for my MCAT and I was like, no, I just want to do acupuncture. And I learned if you're an MD, you only need 300 hours to become an acupuncturist.
Okay.
If you just go to acupuncture school, it's 3,500 hours.
I'm sorry, so 3,200 more hours?
Yeah.
Okay, I just thought
Yeah.
That's a pretty big difference.
It is. And New Jersey passed for physical therapists to do dry needling.
Correct.
And that's a 40-hour course.
Right, which is tiny.
Versus 3,500.
Right.
So it's a lot of school. It's a 3-year program.
Okay.
And then I did the herbs as well, which is a 2.5-year program. But my last year of acupuncture school, I started my first year of herbs. So I could.
Oh, wow. Oh, you didn't sleep that year, did you?
No. My husband will say, he's like, ooh, that was a very hard year. Because I was trying to get 2 master's degrees. I was working 3 jobs. We were new to it because we moved here from Florida.
Huh. I mean, chaos. Sometimes you just got to live in it for a little bit.
Yes.
You can fix yourself. You can heal yourself.
Yes. That's what I do miss about acupuncture school because it's so hands-on.
Yeah.
And I would get treatments all the time.
Oh,
so nice.
It's so nice. It would be nice to go back to school sometimes. You're like, this is glorious. So I know we're probably running out of time. What would be the best way for folks to contact you if they're interested in acupuncture with you? They have questions about you. How would they get in touch with you?
So I email or call or even text.
Okay.
I love doing free phone consultations. So I feel like it's more personable to like hear my voice.
Yeah.
I'll take phone calls. I ask or I answer any questions, and about specific conditions and telling like how acupuncture would benefit that. So email, phone call, text, that's all.
Perfect.
Yeah.
And I can link all your information in the comments, but do you want to throw your phone number out here for anyone who's listening? And go ahead.
So it's 310-951-8281. My email is R, F as in Frank, ANALIACU@gmail.com, Rfanaliacu. Yeah. And
perfect. Awesome. And you do an event here Mondays, like a community acupuncture event.
We've been trying to get it to take off. It's been a little slow.
Okay. That's how life goes.
Yes, it's once a month. I think it's the second Mondays. And I really wanted to do community acupuncture because it's very common in Philly, but there's not many community acupuncture places here. And it's a way, like you're not getting a private session.
Right.
But I have those zero gravity chairs. They're in a circle. So it's community because you're around the community, and you can come and try acupuncture, and it's much less expensive compared to like the private sessions. So I wanted it just something to be affordable.
I love that. It's a great way to kind of, if you're scared, take a little tiptoe. But perfect. Well, Rebecca, thanks so much for joining me on the porch. It was great to learn more about you, about acupuncture, and what you bring to your clients here. So I wish you continued success. Oh, my pleasure. But it was fun. Cheers to Friday. All right. And thank you all for tuning in, and we will see you next Friday. Have a good day.